When someone says that they have a gummy smell, what that means is that they're looking at their teeth and they notice less proportion of their teeth compared to the amount of gum. So this can look like when they're smiling, they see more pink around their teeth, and there's usually to the naked eye like a nice proportion of tooth and gum where it looks symmetrical. So when someone's saying, I feel like I have a gummy smile or I have a gummy smile, then they're noticing more of the pink gum present and less of the tooth structure when they're smiling or talking. We determine if a gummy smile is the way that it is if based on like the teeth are positioned or by other things. But so like if we notice that the teeth aren't aligned correctly, then we might notice that the gum is growing and it's just bigger. We might also see a gummy smile if there happens to be bacteria under the gums and there needs to be like a deeper cleaning. So bacteria is getting trapped under the gums and we might notice just more gums. So we determine that by being able to take x-rays, by our hygienist checking the measurements between the gum and the tooth to make sure that there is no bacteria underneath, and just visually also looking to see how the gums are coming together. We determined what a gummy smile is caused by looking at a number of things. We look at the x-rays, we have our hygienist check measurements of the gums, and we take just a good look at what this patient's habit is. So if there is bacteria lining underneath the gums, then that might be a cause of creating a gummy smile. If it's the way that the teeth are coming together and just creating excess gum, that might be another reason. And we also utilize the x-rays to be able to tell us what is happening in the bone. Is there something that is causing an excess amount of growth of gum? And so all of those tools help us check that out. Laser gum lift does sound intimidating. So it's definitely sounds scarier than what it is. Patients, once we explain to them what to expect, they end up being very receptive to it. We numb the area up nicely, get the patient very comfortable, and then we use a laser that goes scalloped around each tooth, creating a nice symmetry with the teeth and the gum, so that way there is an even proportion of tooth and gum. The ideal patient that would be a great candidate for laser gum treatment would be a person who has excess gums, who we know would benefit from reducing the amount of gum lining their teeth. So this could be, a young student just wanting to feel comfortable and confident in their smile whenever they're talking, and we can easily provide a nice smile by reducing some of the gum. This could be someone if they've had braces and there's excess gums just lining their teeth. As soon as they get their braces off, we're able to do some laser around the gum line and create a nice scalloped gingival lining around their teeth. Gum lift can definitely help without changing the tooth structure, because what it does, it exposes more of the tooth surface. So if a person has a gummy smile, they're going to smile and they're going to see a lot more gum visible than the tooth. So once we do that gum lift surgery, there's going to be more of that tooth surface exposed. It's going to look more symmetrical to the gum. It's going to be aesthetically more pleasing, and I definitely notice that it's going to bring more confidence to that person. Recovery after a gum lift surgery a patient can expect some sensitivity, tender gums. We recommend that they use softer strokes when brushing, not be heavy-handed, utilize warm saltwater rinses, and even eliminate foods that might be jabbing into their gums, such as chips. So patients might have to alter a little bit on their habits, just being more gentle and soft with their gums. But it's very minimal, and it maybe goes between like 4 to 6 weeks where they have to just baby their gums a little bit more. Gums are very resilient, so they do heal quite quickly. Emotionally, patients will find just such a transformation from what I've noticed. Patients, a lot of the times, are their own worst critics. They don't like the way that their teeth look, their gums look. They're the ones looking at themselves every single day in the mirror, and they're their toughest critics. So whenever we are able to transform their lives and create and do a service such as gum surgery, they feel so confident, they feel so happy, they feel like they're able to smile more, and that really is very rewarding.